My name is Somia, and I'm a master's student at the University of Delaware. My poster is the endothelial ETB receptor expression in young and older men. Cardiovascular disease is the leading cause of death in both men and women. Changes in endothelial function precede the development of atherosclerosis and cardiovascular disease. Our laboratory previously demonstrated that aging leads to a decline in the endothelial cell endothelin B receptor expression in postmenopausal women compared to younger women. The age-related decline in endothelial ETB receptor expression has not yet been studied in men. Therefore, we compared levels of endothelial cell ETB receptor expression in young men and older men. We hypothesized that endothelial ETB receptor expression would be attenuated in older men compared to young men. We recruited younger and older men that were healthy and free from chronic disease. Venous endothelial cells were harvested from an antecubital vein by threading a thin J-shaped wire through an IV catheter. The guide wire was moved back and forth in order to collect the endothelial cells. Then it was removed from the catheter and placed in a dissociation buffer to get the cells off of the wire. These cells were then centrifuged, rinsed, and placed onto cover slips and fixed. The cells were stained with DAPI in order to identify the nucleus of the cells, V cadherin to ensure that the cells were endothelial cells, and our primary antibody, ETB. We used immunocytochemistry to assess ETB expression, and 30 cells per person were averaged. We assessed endothelial function via flow-mediated dilation. A longitudinal image of the brachial artery was captured using ultrasound. The diameter of the artery was measured continuously at rest and following 5 minutes after ischemia. As seen in Table 1, the men were healthy and, as expected, older men had higher blood pressure and cholesterol. However, these were all within clinical limits. Surprisingly, we did not see differences in FMD. The main findings are shown in Figure 4. Endothelial ETB receptor expression was similar between younger and older men. Representative images of ETB expression in an individual cell from a young and older man are shown under the raw data. Finally, we did not observe any correlations between ETB receptor expression and baseline cardiovascular variables such as blood pressure or cholesterol. In summary, these preliminary data suggest ETB receptor expression is not lower in older men compared to younger men. This is in contrast to our previous findings in women, supporting the known sex difference in the endothelin system and the regulation of the ETB receptor.